something fresh. Listen to Salam Media, your humanitarian broadcaster.
Welcome back. You are listening to the Maran Gwanda Show on Salam Media. It's time for our Women Health segment. I've got Dr. Tom Mokaya on the other side. He's an OBGYN. He's an OBGYN. An obstetrician and gynecologist here. So he has close to 20 years of experience in the field. Today we're going to be talking about something that is called vulvodynia. And I came across this, I'm like, vulvo what? Vulvo who? But anyway, vulvodynia is a chronic, unexplained pain in the area around the opening of the vagina. Dr. Tom, hi.
Hi, how are you and to your listeners?
I'm very well, thanks. And yourself?
I'm good.
Thank you. It's always a pleasure to have you. All right, so Dr. Tom, I'm not sure if my definition of vulvodynia was elaborate enough, but if it wasn't, can you please expand on it and what causes vulvodynia?
Now, you're right. Vulvodynia is essentially pain or a sensation around the vulva. So your definition was on point. In the medical profession, we have other complex definitions, but most of those ones are academic. So vulvodynia is essentially pain or itchiness around the vulva. And as one may know, technically, the vulva can either be the labia majora or the labia minora, which means the big lips of around the vagina opening and the small lips of the vagina opening. So any pain or itchiness around that area is called vulvodynia.
Mm-hmm. So what causes it?
Now, there are multiple causes of vulvodynia. And just like any disease, we classify it according to different possible causes. So it can either be caused by an infection, it can either be caused by an allergic reaction, or at times we don't even know what the reason is. Now, when we go for infection, the infection can either be viral infection, which are caused by viruses, or they could be infections caused by either bacteria or a fungus. Now, the commonest cause of vulvodynia is the one caused by a fungus, candida infection, which is a very, very common infection. The fungal infection, most of the time, it's not necessarily transmitted sexually. It can be caused by one who has either somebody who is, let's say, diabetic. We tend to find that they tend to have more infections associated with the fungus. So vulvodynia can be caused by fungus, or it can be caused by a virus. Now, the viruses that cause them are things like herpes. Herpes is around the vulva, is a cousin to fever blisters, and that can also cause vulvodynia and itchiness around the vulva. And it can also be caused by other allergic reactions. At times, we don't even know what causes it. So there's a whole long list of possible causes of itchiness around the vulva.
Mm-hmm. All right. Is it the pain? Is it different for different women, like period pains, or is it the same? Everybody experiences the same type of pain.
Good question. The pain can be different. It is a pain which can either be a dull, aching pain, or there's some which can have intense pain, where the pain is so intense that one is not even be able to walk. Every time they walk, they feel like they can't even be able to walk. And there are some who describe it as a burning pain. It's as if somebody has gotten something hot and put it around the vulva. So it's a burning pain. So the pain associated with vulvodynia can be described differently. So when we see a patient coming to see us, most of the time, the way the patient describes it can give us almost like a guideline on which of the possible causes it could be. And as I said, there is some causes of vulvodynia which are associated with allergy. There are people who have let's say, who have urticaria, which means they itch around, let's say, not around the armpits, but around the elbows. So you may find that the same kind of disease may also affect the valgus. So they are always itching all the time. You feel like you want to itch there all the time. And once you scratch, it goes away. And the associated pain also tends to get better. So patients will describe that pain differently depending on what the cause is. And there are instances where that pain may be caused by cancer. And if it's caused by cancer, it can be deep-seated pain. And at times when they scratch or they itch around that place, one may easily be able to, one may either be able to bleed.
All right. Now, how is it treated, and is it something that lasts for forever? Is it chronic? Does it last for a while? If so, how long does it last?
Now, before we treat anything in medicine, obviously one comes and they complain of what they're complaining. As you ask what kind of pain it is, how long it's been there, and after that, an examination is done. If it's an infection, let's say candida, that can be treated by antifungals. At times it can be recurrent, or at times it can be caused by a virus, as I say, that can be treated by antivirals. And if it's recurrent, let's say it's a candida, if it's recurrent, then and somebody has a partner, so we also have to treat the partner. If it's caused by a virus like herpes, we also have to find out whether the partner has it, and therefore we treat it also so that it doesn't become recurrent. If it's caused by, so that's how we treat the common ones. Now, if it's the ones which are associated with the allergy, for example, where we've ruled out infections, it's important to rule out infections. Then if it's caused by allergy, then we treat it with things like steroids, which will tend to reduce the itchiness. So the way in which we treat, let's say urticaria, which is an infection around the elbows, the same way that we'll be able to treat the infection, the itchiness around the vulva. And of course, if it's caused by cancer, then we take a biopsy, which means we take a piece from around the vulva. There's a special instrument that we use, and that is sent to the laboratory. And then they can tell you, yes, this is what you've got, and therefore we treat it appropriately.
Mm-hmm. All right. So what about someone who has boils? Would that in any way affect it, or would it be sort of connected in some way?
Now, boils, which are most of the time, I suppose when you talk about boils, it's an infection which has a small accumulation of pus, which means it's most probably caused by a bacteria. And at times you may find it around the vulva, or you may find it around the vulva and in other parts of the body. So once we find it, depending on how big it is, there are some boils which are very big in size and they are very painful. Those ones may require a small surgical operation, which we incise and drain, which means open and drain. After opening and draining, there's a specific procedure which we call marsupialization, where we open, drain, and open up the boil so that it doesn't close from outside, but it closes from inside. In a case like that, the whole cavity closes up. And then after that, if necessary, we also cover that with antibiotics. So if there are boils there, and most of the time, you find that there are some who that boil is also found in other parts of the body. And if it's found in other parts of the body, we also treat that appropriately, and we may also cover with antibiotics. So that's how we treat the boils.
Mm-hmm. All right. And now coming to food, are there any foods which can trigger vulvodynia?
Yeah, that's also a good question. As part of the history taking, we find that there are people who are predisposed to, who develop allergy to particular foods. And just like they may itch in other parts of the body, they may find that they are allergic to particular food, whichever food it is. And there's a whole range, and there's no particular food which will cause that kind of allergy. And once they take that food, they find that they're feeling itchy all over the body, and some of them itch around the vulva. Secondly, if one has candida, as we always say, Candida likes eating sugar. So if one eats sugar food, the sugar ends up everywhere. It ends up in the mouth. It also ends up in the vagina. And around the vulva, if there's fungus, the fungus will grow. And that is why we find that many women who have diabetes or who have what we call as glucose intolerance tends to have a lot of candida. And at times, not even just candida. They may even have what we call as diabetic valvodynia, which is pain around the valve associated with diabetes. There's no infection. We take biopsies. We can't find anything. The only thing we find is that they've got changes which are associated with diabetes. So anything that is sugary, when we talk about food, may at times precipitate the pain or may make the pain appear and get worse. And obviously, as I said, allergy, and if it's allergy, most of the time, those patients are treated by people we call allergy specialists, allergologists, which will find out which food or which protein in food stimulates that kind of allergy. And therefore, foods do also tend to precipitate or make the vulvodynia worse.
Okay, and can women of different ages get vulvodynia, or is only a specific age group?
Yeah, vulvodynia can occur at any stage. And the age at which it occurs may be able to give us a guideline on what we need to look for. If I may start from women who are much older and who are postmenopausal, most of the time it's either because the skin around the vulva has undergone atrophy, which means it has gotten very thin. And although I didn't mention it as part of the possible causes, I said the other causes which may cause vulvodynia. With menopause, the skin tends to become very thin, and that can cause pain around the vulva, which will not occur in somebody who is in their early 20s or early 30s or even 40s who have not gone into menopause yet. So the age at which this particular condition presents is very important in us trying to find out which way to go when we're investigating. And secondly, apart from the skin getting thin and undergoing atrophy because of the lack of estrogen, the older women are predisposed to getting cancer or precancerous lesions around the vulva. And therefore, those ones are more likely to occur in somebody who's older than somebody who is younger. At a younger age group, the commoner causes are things like candida. However, something else that I didn't mention may cause vulvodynia is we find that there's some pain around the vulva, which is associated with patients who have depression. Patients who are undergoing stress at times present with pain around the vulva. And most of those ones are treated by giving them either tranquilizers or antidepressants. And we find that pain actually goes because we found that depression can present itself in many ways. And we do get patients who are undergoing depressive states or who are depressed or who are anxious for whatever reason. And they present with vulvodynia and we treat them with anxiolytics or antidepressants. So the age at presentation, as you asked, is important in trying to lead us into which way to investigate.
Mm-hmm. All right. And if not treated, can vulvodynia become something worse?
Pain anywhere in the body, if it's not treated, can when one has pain all the time, it's not a good thing to have pain all the time. So we find that patients who have chronic pain will easily go into a depressive state. And once the pain is sorted, then they become, for the lack of a better word, happier. So if pain around the vulva is not treated, it can cause a lot of psychological problems. That is one aspect. And the other aspect is if, for example, chronic candidiasis is not treated, okay, one of the ways in which to treat is to look for the cause. There are patients who come, you keep treating them with medication to treat the candida, yet you forget to investigate for diabetes. So that may also lead you into developing diabetes, which would otherwise have been managed earlier. And in the older women, if those lesions, which are precancerous, are not treated, they could easily lead into cancer. And something else that one needs to realize is that pain can lead to a lot of scratching, because the place can be very itchy or it can be painful. So a lot of scratching around the vulva makes the skin very, very thick. And that may cause some women to find it very difficult when they are being intimate with their partners and they have pain, because the skin around that area has gotten very thick and it can become very painful. So it can lead to other things like lack of interest in being intimate with somebody's partner. It can cause bleeding because the skin has changed. And obviously, not being intimate with one partner can finally lead into marital issues, etc., etc. So it can roll over to cause other problems.
Thank you so much for your time, Dr. Tom. Very informative discussion that we've just had, and thank you for sharing your knowledge as well.
Thank you. Thank you so much for having me.
Right, that was Dr. Tom Mokaya, OBGYN, talking about vulvodynia, which is a chronic unexplained pain in the area around the opening of the female genitalia. All right, you can get some more research on this topic. It is available on the World Wide Web, also known as Google. Google knows everything. But anyways, if you have more questions and comments for Dr. Tom, you can leave them in the comment section below or send them to us on WhatsApp. The number is 061-766-0355. And you can ask Dr. Tom anything that you'd like to know about women's health. He does have over 20 years of experience. And we have Women's Health Tuesdays where we discuss specific and pertinent issues that women go through. And, you probably wouldn't have thought that such would happen to you, or you probably don't know how to describe what is happening to you. You think that maybe you're the only person who has this condition, but you're not alone. There are other women out there who are going through something similar or the same, and there is help available.
Listen to something fresh. Listen to Salam Media.
This is Nasheed Radio, every weekdays from 1 to 2 p.m. on Salam Media.
سرنا بعون الله منهاجنا تقوى سرنا بعون الله منهاجنا تقوى